to a Process 23 presentation. At Process 23, we help you build the DNA of your business. Today, I want to talk to you about my copyrighted rapport-based selling technique. Have you ever presented treatment to patients and they look at you skeptically? They think that you must be crazy or that you just presented something that's way out of range with what they think they need. I want to share with you a technique that will help you enroll your patients in the treatment planning process. Rapport stands for Relational Assessment questions, Plight questions, Prognosis questions, and treatment questions. Going through your questions in this sequence will help your patients to get enrolled into the process of understanding what it is that you recommend for treatment for their mouth. So relational assessment type questions. Ask the background or facts. That's what these questions are. So tell me, how long has this tooth been hurting you? How did this happen? When does this tooth hurt? These are the background questions or fact gathering questions of the process. These are the things we already do extremely well. The next part is the Plight questions. Ask about the patient's problems, difficulties, or dissatisfaction related to what's going on in their mouth. These are the things that they're not thinking about. This is us now trying to get them to think about what's already going on in our minds. We know that this patient obviously grinds their teeth. We know that they probably have some parafunctional habits like chewing on ice. We already know these things, but we need to enroll them in the process so that they realize it as well. Mary, do you grind your teeth? Or has anyone ever told you that you maybe grind your teeth? How long have you had these fillings in your mouth? Because most fillings only, last maybe 15 to 25 years. Something like that. How bad does this tooth hurt here? Asking questions like that enrolls them into the thought of difficulties or dissatisfactions related to their mouth, which they already are aware of, but that you haven't brought them to the surface until you ask these questions. Prognosis questions. Ask them about the problems in their mouth and the consequences or effects or impacts of doing treatment or not doing treatment. What effect do you think it'll have on your teeth, Mary, if we don't do anything about this? Do you think that that tooth will start to hurt? And Mary, when do you think that tooth will start to hurt? What do you think will happen if we leave it like this? Because if a patient comes in with a tooth that's broken, what they really want you to tell them is, you know what, I'll patch it, it'll be fine for another 6 months to 2 years. That's what they really want you to tell them. But the reality is that we need to enroll them in the process to get them to think about, what do you think will happen if we just leave it like that? The next series of questions are the treatment questions. You want to ask about the value or importance or usefulness of the treatment. Would it be important to you to know that this tooth would not break again? Mary, would it be important to you to know that we could fix this tooth permanently so you don't have to worry about it breaking again? Would you like to know that you can chew with confidence knowing that this tooth wouldn't hurt? Would it be important to you to know that you wouldn't need a root canal down the road on this tooth, that we could fix it today? Asking treatment type questions gets them enrolled in the process of treating the tooth so that you're not just the one telling them what they need. They essentially tell you what they think they need. They go, no, I want to fix this tooth permanently so I don't have to worry about it again. Great. In our office, we call that a crown. And here's what that will do for you. And then we go into the value equation. We talk about the seriousness of the problem. We talk about what a crown can provide. We talk about the value of a crown. And then we present the cost. Going through that process enrolls the patient in that and engages them. And essentially, they make the decisions without you telling them what they need. This is my graph that goes through the process of relational assessment questions, Plight questions, Prognosis questions, and treatment questions. It's available to you as a download, as an extra bonus for this video. Print it out and share it with your team. These questions are the most effective if you practice them. So practice them with your team, practice them with your assistants, your hygienists. Next time you have a team meeting, pull out this sheet and go through the process so that when you sit down with a patient, it rolls off your tongue smoothly and it goes very clean and the patient gets it and enrolls in the process, and your treatment plans will be more effective. It will help your patients move forward with treatment. Thank you so much for the opportunity to share with you. At Process 23, we're dedicated to helping you build the DNA of your business. Make today great.